Have you ever wondered why so many men after the age of 50 suddenly begin to notice changes in their sexual health, even though they still feel mentally young and active? As a doctor who has spent many years speaking with men about this sensitive topic, I can tell you that one of the most common questions I hear from patients is this: Doctor, is there any natural way to improve blood flow and support stronger erections without immediately depending on medications? What surprises many people is that there is a simple technique discussed in traditional medicine that involves stimulating a specific pressure point on the body to support circulation. And when used correctly, it may help improve blood flow, relaxation, and nerve signaling, which are all critical for erectile health after 50. Before we go deeper into this topic, please take a moment to press the like button because this helps important health information reach more people who might feel embarrassed to ask these questions. And if you have any doubts or experiences related to men's health after 50, please share them in the comments section below, because open conversations can help many others who are silently facing the same concerns. And of course, make sure you subscribe to this channel so you never miss our weekly doctor-explained videos about healthy aging, heart health, and longevity. Now let me start with a question that might feel personal, but is extremely important. Did you know that more than 50% of men between the ages of 50 and 70 experience some degree of erectile difficulty at some point in their lives? This is not just an assumption, but a statistic supported by research published in the Journal of Sexual Medicine and Studies, such as the Massachusetts Male Aging Study, which found that erectile dysfunction becomes progressively more common with age due to changes in blood vessels, hormones, and nerve function. Many men assume that erectile problems are purely a sexual issue, but medically speaking, they are often a signal about something deeper happening in the body, particularly related to blood circulation and cardiovascular health. In fact, doctors sometimes refer to erectile dysfunction as an early warning sign of vascular disease because the blood vessels in the penis are smaller than those in the heart, meaning circulation problems may appear there first before symptoms appear elsewhere. Now here is where things become interesting. In traditional Chinese medicine and certain integrative medical practices, doctors have long discussed the role of acupressure points that may influence circulation, nerve pathways, and relaxation responses in the body. One of these points, often referred to as the CV4 or conception vessel 4 point in acupuncture literature, is located a few centimeters below the navel in the lower abdomen. Practitioners believe that gentle pressure or massage applied to this area for a few minutes may stimulate pelvic circulation and support reproductive organ function. While this technique should never replace proper medical treatment, some small studies and clinical observations have suggested that acupressure and relaxation techniques can improve blood flow and reduce stress responses that negatively affect erectile performance. Research published in journals such as the Asian Journal of Andrology has highlighted how stress, poor circulation, and nerve sensitivity play a major role in erectile function, meaning techniques that improve relaxation and blood flow may offer supportive benefits. Let me share a real story from one of my patients because this topic often becomes easier to understand when we connect it to a real human experience. A few years ago, a 62-year-old patient named Mr. Kumar came to see me because he was worried about his declining sexual performance. He was otherwise healthy, still working, and enjoyed walking daily, but he had started to feel anxious because his erections were not as strong or consistent as before. At first, he believed this meant something was seriously wrong with him, but after reviewing his medical history, we found that his blood pressure was slightly elevated, his sleep quality was poor, and he experienced significant stress at work. I explained to him that erectile health is strongly connected to overall cardiovascular health and nervous system balance. Along with lifestyle improvements such as regular exercise, improved sleep habits, and stress reduction, I also suggested he try gentle abdominal breathing and massage of the lower abdomen each morning to stimulate circulation. Over the next few months, he reported not only improvements in his sexual confidence, but also better digestion, reduced stress, and more consistent energy levels throughout the day. What this story teaches us is that sexual health is rarely about a single body part. It is about the entire system working together: heart, blood vessels, hormones, nerves, and mental well-being. According to the American Heart Association, healthy blood circulation depends heavily on lifestyle factors such as physical activity, balanced diet, weight management, and blood pressure control. When blood vessels become stiff or narrowed due to conditions like hypertension, diabetes, or high cholesterol, it becomes harder for sufficient blood to reach the tissues that require it, including those involved in erectile function. That is why cardiologists often emphasize that improving heart health can also improve sexual health. Now, let me explain the simple technique many practitioners discuss when referring to this pressure point. While lying comfortably on your back or sitting in a relaxed position, place 2 or 3 fingers about 2 finger widths below your navel in the center of the lower abdomen. Apply gentle but firm pressure and slowly massage the area in circular motions for 2 to 3 minutes while breathing deeply and calmly. The goal is not to press painfully, but to stimulate the area and encourage relaxation of the abdominal muscles and improved circulation in the pelvic region. Deep breathing during this process is important because slow diaphragmatic breathing activates the parasympathetic nervous system, sometimes called the rest and repair system, which plays an essential role in erectile responses. Scientific studies in the field of psychophysiology have shown that relaxation techniques can significantly influence blood vessel dilation and nervous system balance. However, it is important to remember that this technique alone will not magically solve erectile problems if the underlying causes involve serious medical conditions. Conditions such as diabetes, atherosclerosis, hormonal imbalances, medication side effects, and prostate issues can all contribute to erectile dysfunction. In fact, the National Institutes of Health notes that erectile dysfunction affects around 30 million men in the United States alone, and the prevalence increases steadily with age. This is why doctors always recommend a comprehensive approach rather than relying on a single method. Healthy habits such as walking for at least 30 minutes daily, maintaining a balanced diet, rich in vegetables and healthy fats, managing stress, and ensuring adequate sleep all contribute significantly to vascular health. Research published in the American Journal of Cardiology has demonstrated that regular physical activity improves endothelial function, which is the ability of blood vessels to expand and deliver adequate blood flow throughout the body. Another important factor many men overlook is testosterone balance. While testosterone naturally declines with age, lifestyle factors such as obesity, chronic stress, and poor sleep can accelerate this decline. Studies in the Journal of Clinical Endocrinology and Metabolism have shown that improving sleep quality and reducing body fat can positively influence hormone balance. Even something as simple as getting regular sunlight exposure and maintaining vitamin D levels has been associated with better hormonal health in several clinical studies. Emotional well-being also plays a critical role. Anxiety, performance pressure, and relationship stress can trigger the body's fight-or-flight response, which constricts blood vessels and makes erections more difficult. This is why many sex therapists emphasize communication, relaxation, and confidence building as part of treatment. If erectile difficulties persist, it is extremely important to speak with a healthcare professional because effective treatments are available, ranging from lifestyle interventions to medications and medical therapies that can significantly improve quality of life. Erectile health should never be a source of shame. It is simply another aspect of aging that can be managed with knowledge and proper care. So the key message of today's video is this. After the age of 50, your body responds best when you support circulation, reduce stress, and maintain overall cardiovascular health. Techniques like gentle acupressure on the lower abdomen may help stimulate circulation and relaxation, but the real foundation of strong erectile health lies in caring for your heart, blood vessels, hormones, and mental well-being. If you found this information helpful, please press the like button so more people can learn about natural ways to support healthy aging. And if you have questions or personal experiences related to men's health after 50, feel free to share them in the comments because your story might help someone else feel less alone. And remember to subscribe to this channel because in our upcoming videos, we will discuss other important topics, including foods that naturally improve blood circulation, early warning signs of heart disease many men ignore, and simple daily habits that can help you stay active and confident well into your 70s and beyond.